This is Real Talk Radio. This is Real Talk. High Praise Ministries presents Real Talk. This is Real Talk Radio. This is Real Talk. High Praise Ministries presents Real Talk.
All right. And welcome to another edition of the podcast. We are back. I apologize once to everybody who was expecting us here at 7. It's almost 8 o'clock, but that's because y'all know how this is. We are having technical issues. We're trying to sort it out. Hopefully we can push through. If it gets a little choppy, push through. When the rebroadcast goes up on our YouTube channel, it should. So, as always, I am your host, Jesse Jones, here at the Real Talk Podcast, our first episode of the year. God, it's been so long, but we back. And of course, I am here to my left with the wonderful, the always fired executive producer. She's been temporarily rehired. She's almost doing her job this year. She's starting off
one episode.
She's here for the first episode doing her job right. She is the lovely, the one and only Miss Falonda. Say hi to folks, ma'am.
Hi, family.
We in our new digs. Y'all got a little studio background here. That's unusual for us. We're trying to step it up a little bit. We once we get this settled, we'll be much better. But we're here, and so today we got two outstanding guests with us today. I mean, phenomenal people, phenomenal guests. We have, a matter of fact, because these are your folks, and you did such a good job for one executive producer, I'm going to go ahead and let you introduce them.
Wow. So I'd like to introduce everyone to my friends, the Ellises. I'm sorry, let me go ahead in her official title, because we believe in
Never about to say now.
Dr. Sarah Ellis. And Chris Ellis.
Yay!
I'm about to be so childish when I do this, but I don't know how many chances I'll be able to do this ever in life again. And what's up, Doc? I had to. One good time I had to.
Thank you.
All right, I get to be a first. I like it.
So, for those, since this is our first time here, Chris have been friends for 20 years?
833 years.
20 years. Oh, wow.
Yeah,
We're both old.
something like that. Way too long.
We're both old.
We're both old.
Y'all are.
And he got a wonderful, amazing doctor. I will be Dr. Sarah from here on out.
Oh yeah, you all podcast long. You will be doctor. Now you will hear doctor more today than you probably have the entirety of the time you have been a doctor.
Well, thank you. I appreciate it.
So
Thank you. I appreciate it.
are we jumping right in?
You can do the preamble if you want to, then we can jump right in.
Okay. No, go ahead, and then I'll jump in.
How am I gonna do the preamble?
It's your podcast.
I know, but these are your folks. You got the preamble and the history and everything. This is just me facilitating today.
Well, some of it will be in there. This is why I had asked you last night.
But I
can't do my job as executive producer.
I told you this morning though. I told her this morning how the rundown was gonna go. I told her exactly what was gonna happen. Told her the rundown, and then I told her that because of this, the first is more geared toward his health, even though we're going to deal with some holistic health as well. Since that first segment is more dealing with, I as a man should not be starting this thing off. It doesn't make any sense. I don't have the plumbing to be able to have the right to have some of these conversations that I can expand it some and get into some of how some of this goes together, and can help us all. But overall, I'm a dude. Me and Chris, we gonna sit out for a little bit. We gonna have our chance to talk, but this is y'all for the moment. We gonna yeah.
All right, so a little backstory. This first segment is health. So here's a little confessional time. We know that I am very unfiltered on here.
Oh yeah, y'all don't. That's right. Y'all know how she's worse.
I overshare. So here it is. I want to say maybe 6 months back, I had started having some uterine issues, and like I went out, and I don't know, we're here in Atlanta, and I figure it's got to be plenty of black doctors down here, because this is one of the black, like other than Africa, Atlanta. It's got to be plenty of black doctors here. And so I went around shopping, visiting, trying to find a doctor. And I did not know it was so difficult after a certain age to find a doctor who will listen to you. Like, I don't know what happened, but I guess when I crossed the threshold of 40, they were like, oh, well, you've been using that thing, so keep going until it stops.
You got this.
Functioning.
Using that thing.
Right, they're like,
You got this. You don't need our help.
it's on all at this point. Come back when it stops working.
And then it's like, oh, we'll take it
And
out.
I'm like, right.
It's like, oh, we'll take it out. Don't worry.
No, I didn't even that part. Like, they were like, oh, just keep doing what you're doing. It's fine. And I'm like, but I'm not planning on having no babies because I'm a grandma. And that looks weird. I've seen people who do it, but typically, they are of a lower standard. Not to be bougie anything.
Wow. The views expressed just there are the views of Philonda Wright herself, Philonda herself. They are not the views of the Real Talk podcast.
Okay, please put the little asterisk.
Gotta protect the brand.
But no, so like I was like, at this point, I should be in the ballpark of menopause anyway. So we could go ahead and take that on out. And they were like, no, don't worry. It'll just run its course. I'm like, okay, well, that's not helpful. So eventually I was watching TV. I'm watching TV, and this doctor's on this episode of a show here called, oh God, and I can't remember her show.
She ain't giving a free advertising.
No free marketing. I'm
no,
sorry.
you have to pay for the marketing.
So I was watching there's a black woman who's a former newscaster here in Atlanta who has her own talk show. And she was doing a special on her journey with dealing with fibroids. And she had this doctor on there, and I was like, well, that lady looks nice. Like, she looks like I probably can't afford her. She probably doesn't take my insurance, but I'm going to look her up anyway and see if I can't make an appointment. And at this time, she was booked. I guess it just really wasn't meant for me at that time. So I was like, okay, well, we'll just keep looking. Maybe in January of this year. So life happened, and let me be honest with you, I struggle with depression, and some stuff had really gotten really bad in my life, and I was like, okay, at this point, something's got to give. I can't deal with both of these at the same time.
Yeah.
One of these, either the female problems got to go.
Yeah.
Or somebody's got to put me on Prozac or something.
Or they could be feeding
But we
each
can't
other
do both.
and making each other worse. Yep. Or they could be feeding each other and
Right.
making each other worse. Yep.
So I went and I went to this doctor's appointment, and I told the doctor, I was like, okay, look, Did you lose the camera?
I heard it. I think so. I heard it. Keep going. Keep going.
So I was like, okay. I feel like I should be in menopause. When does that start? I don't have any family history of any women who did not have a hysterectomy, so I don't know how this works in my family. I don't know how my body works. I don't know what to look for. I really want this all to stop because I'm not having no more babies, and I don't have any tubes. So at this point, this is kind of pointless.
Right.
Other than in vitro, we can't have a baby anyway.
Right.
So, and so my doctor was like, okay, I'm hearing what you're saying. I'm hearing everything. I hear all the symptoms. This is all okay. Great. She said, and she did something, but she was like, how do you feel? I was like, I have problems. That's why I'm at the doctor.
Oh.
I was like, well, look, I am 2 seconds away from suicide. Let me just be honest with you.
Right.
I was like, it is taking everything in me not to cry in the middle of this appointment. And she was like, and she began to ask me a list of questions. She was like, okay, so is this something that you have a history of? And I was like, me personally, yeah, like I've been dealing with depression on and off for years. And she was like, okay, what about your mother? What about other family members? And then she just began to act like your general family history. Everybody in my family over a certain age got diabetes.
Right.
Like these are just the things. And I just began to run down my family history, and she was like, okay, have you ever had a chromosome test done? I was like, what? No. Do I have Down syndrome? Stupid question, I know. But this is the kind of stuff that goes on the doctor's office. And she was like, I'm thinking that's happening is that you have a...
Go on. Just keep talking.
Okay. So, that you have a chromosome deficiency, and I want to test you for that. And I was like, okay, do whatever it takes. She was like, if it is what I suspected it is, then all of these symptoms are coming from the chromosome deficiency, and we can treat it with supplements. I was like, supplements? What do you mean? Doctors don't give supplements. Doctors give drugs.
Right. Well, they catching on.
Right.
Well, they catching on.
They are. And so she was like, we did the test, and sure enough, I have the condition. If anyone wants to ask, I will type it in the comments because I cannot pronounce it. It is a long word. Google it for yourself. But so yeah, I was diagnosed with that, and she started me on a supplement regimen to deal with all of the symptoms and my deficiencies. And when I tell you, like, this is some of the best I have ever felt in my life, and I don't know if it's the placebo effect or is the stuff really working, but I just find it amazing that we can have answers. So in the attempt to get answers for other people, I started, like, is my mic muted?
No, you're good. You're good.
Okay.
We can hear you.
Okay, so I started looking for, like, more doctors who deal with holistic medicine. Because, like, if you look under my insurance provider, they don't come up. If you go to, like, the Anthem website, these kind of things don't come up. And
they're not going to pay any of that.
Right. And so, again, I ran across Dr. Sarah's website. I took one look at the picture and was like, wait a minute. I know her. She looks familiar.
Because one of the big patterns that's popping up now is functional medicine doctors, right? And these
I'm sorry,
are
can you explain what that
generally-
is?
Yes. So functional medicine
Okay.
doctors are generally MDs, and some naturopathic doctors call themselves functional medicine doctors. But it's essentially medical doctors, MDs, who desire to have a more integrative and holistic approach, but for obvious reasons are not going to go back to naturopathic medical school. And they want to learn ways to incorporate some of those practices and thought processes into their practice. So if you are an MD, you've already graduated from med school, gone through residency, fellowship, all of those things, and you want to incorporate functional medicine or holistic medicine, the Institute of Functional Medicine is a great place to start for people who are already kind of grounded into the usual medical model, right? Which is MDs and DOs. Their education is written by NDs, by naturopathic doctors. So you'll be learning from us, from naturopaths. If there's some med students out there or undergrad students who want to go to naturopathic medical school, who want to become a functional medicine provider, there are options. You absolutely can go to traditional medical school, and then there is a fellowship, an integrative medicine fellowship that you can apply for, a residency and a fellowship that you can apply for. Or you can go to naturopathic medical school, which would be my first option. My first option, if you want to really embrace this, you should go to naturopathic medical school. I will let you know, like from jump, the student loan debt is ridiculous, okay? You also have to understand that when you're becoming a naturopathic doctor, you are also becoming a medical entrepreneur, because there isn't necessarily a already made funnel or pipeline for us to go into. Typically, MD and DO graduates, they go into residency and a fellowship, and they set up at a teaching hospital or create their own private practice. And then they have insurance that helps make sure that they get paid, right? For us, well, unless you're in Oregon or Washington State, or sometimes I think Arizona as well, I'm not 100% sure, you can't take insurance. And so you're cash-based. And so you're essentially going to be a medical entrepreneur, and you're going to have to convince folks to see you and pay out of pocket. Right. In some cases, they can apply for reimbursement through their insurance company, but that's hit or miss on whether or not that will go through. So if you're already an established doc and you want to transition, look up the Institute of Functional Medicine. If you're undergrad, med student, look into naturopathic medical schools. I went to Bastyr University. There are 5 currently in the US and 1 combined campus in Canada. And there's even a school out in Puerto Rico. So we're kind of all over the place, and I would have them start there for sure. My biggest advice, especially for established docs and even some med students who originated in like allopathic, so MD, DO students, when you're transitioning into functional medicine, you have to change your mindset, okay? MDs and DOs, they're trained to see problems and like direct it to one specific thing. Like, okay, and they silo different organs. Like, okay, you have a stomach issue. There's no way that could involve your nervous system. We'll focus on your stomach, not really taking in the whole person. And so it takes a lot of reprogramming to really begin to see someone as a whole entire person and not just a symptom.
That makes a lot of sense, because I was wondering, how did my gynecologist be able to like assess that there was an issue with my chromosome? So yeah, having a different mindset.
Yes, and she sounds well trained. She sounds like she really has a passion for this and listens to her patients and putting pieces together. Because a lot of times as a doctor, we're detectives, we're just trying to piece clues together to figure out what's going on with you.
And I have to admit, I am one of those problematic patients. Like they'll go into the doctor and be like, "And how are you doing today?" "I'm fine." And and you
Oh,
hope everything is falling apart. I know.
yeah, no,
Like,
that doesn't benefit
Yep, she
anyone.
is a habitual liar.
And listen, think about it like this: you paying for your insurance, correct? You pay a
right.
premium every month. So when you go to your doctor, you go to your doctor to talk business.
What are some things we could do as patients to be better, to help y'all help us?
Very good question. Be honest. And I think that that's an issue with us as Black women because we wear so many different hats. We're responsible for so much that we don't want to inconvenience anyone. We don't want to put a pause on our show because if we don't do it, who else is going to do it? And sometimes we just feel like it's not that serious. You know, we're like, oh, everybody has a little ache or, no, that's actually an issue. You should talk to me about that. So be honest. Um, Try not to carry any shame or stigma about whatever symptom that you're experiencing. And really, and I know this is difficult because some doctors, they see so many patients. So they're in and out, quick questions. You good? You all right? All right, I'll see you in a couple of months. But if you have a doctor that's willing to take some extra moments with you, really use that to talk about what's bothering you.
Okay. Yeah, as we say, I'm part of I do better.
I don't know if she's really actually trying to do better,
I
but
am.
we
But
gonna tell
I
the
think
truth.
what helped was finding someone that I actually like for the first time was like the when we moved here from Columbia, white male general practitioner.
Yeah.
I kid you not. He would literally come in the room, and if my husband was present, he would talk to him the whole time, the patient.
I'm sorry.
Oh,
What?
yes, he would
That's
talk
wild.
to him. He wouldn't even make contact with me. He'll come in the room and he'll literally be like,
Like,
"How are we doing?" I'll begin to talk to him, and he'll be like, "My God, are you? What are you doing?"
On a
Yeah,
regular,
no. What?
I was like, okay, clearly you are distracted by my husband. So I went to an appointment with Alvin. He was literally in and out in 5 minutes. I waited on him longer than he actually sat in the room with me.
Stop it.
That's horrible.
I hate that.
That's
And
crazy.
even especially as a practitioner, I can't tell you how many times. Well, it's really only been once now. The last time I saw that doctor, I waited 45 minutes for my visit, my postpartum visit. It wasn't my OB. And then she just popped in, sat me in the room, and didn't see me for another 15 minutes. So I left
Wow.
because I
Wow.
don't have time for it to be wasting money.
Wow.
No, that's like, and I guess that's why we get uncomfortable with,
Yes.
now I have to sit here and start all over again and explain my
Yes.
whole life history. And this person is sitting here and they may be judging me.
Yeah.
And it just, it causes a lack of communication.
For sure. And you know, one of the
so
things
here's a
that I
question I have.
Hold on.
oh, go ahead.
No, go ahead.
No, go ahead.
One of the things that I learned is that we have a lot of power as a patient. I know that we are raised and just conditioned to see, yes, doctors, they've gone to school for many, many, many years, but it's always a doctor says this or you better do that. But you're the patient. When you go and start looking for new doctors, write down some questions that really matter to you. Do you care that they have an after hours number where if something happens, you can reach them? Do you care that the average wait time for an appointment is 30 minutes? You know, these are questions that you can ask your doctor. And you don't have to call and just ask for a first initial visit. You can call and ask for a quick 15-minute get to know you type of appointment, or ask them if they offer that, so that you can ask questions and see, how many Black women do you normally see? I have a history of this condition. How many patients have you treated with X condition? And it's not in a sense of me that you're a good doctor, but these are the things that I need for a healthy doctor-patient relationship. And if you don't have them, that's fine. I'll just keep looking elsewhere.
Yeah. This is information that's good for me today because I've never thought about doing that.
Yeah.
Listen. This information is good for everybody. And here's the thing, and I'm gonna say this live on air, Sarah. On air, live. But anyway, I really think that something that I would love to see my wife do is create some type of booklet or consultation or something like that that deals with how regular people can deal with doctors and are supposed to deal with doctors and can advocate for themselves.
Yeah.
Because, you say stuff like that and it's just like, I would have never even thought to do that. Who does that? Like, who makes appointments like that and be like, oh, do you offer this type of thing? Because you don't know that you don't know that you don't know that.
Right.
And you don't know that you even need something like that. Or, honestly, as like a life coach, I know that, I know as a life coach, it's really a skill to talk to medical professionals. It is an actual skill. You should learn it. It's one of those things that you don't know what to ask. You don't know how, and plus doctors and medical professionals and scientists will explain all of these things in very specific language that's over your head.
Yes.
And you don't know how to ask, what does that mean?
Mm-hmm. You might feel some shame about that, or you might feel like, well, if it was important, they would tell me.
Right. And it feels like sometimes you go to the doctor and they'll say something and you feel like you're supposed to know that. Mm-hmm. Like you're supposed to know what that phrase means. Mm-hmm. Like you go to the doctor and be like, oh, damn, am I not adult enough? You just nod your head like, oh.
Like, no, that's exactly what my face was looking like. And they're like, okay, sure.
Sure.
Yes. Those are no names.
Yeah. But like, there was a time where there was a relative that was in a bad way and dying. Yeah. And basically, when I went to visit, it was one of those things where you're talking to a relative of mine and they're explaining to them what needs to happen next. And at this particular point, the next step of the process is that they need to go to hospice. They need hospice care. Now, what they ended up saying was the phrase palliative care.
Yeah.
And so I think that's the phrase. So they started using this phrase, and they're like the doctors really throwing around this shit loosely, like with not even a kind of a gravitas of like the phrase you are throwing around. And I think that does happen with like medical professions where heavy things that are major to like customers and patients like have these kind of sterilized phrases that doctors and medical professionals can use to talk to you about it, but at the end of the day, you don't know what that means.
Yeah.
So our relative is over there like, oh, okay, so I guess that's the next step is palliative care. Not realizing that that's like, no, that's hospice. They're dying.
Yeah. And so I was like, wait, they said palliative care? And they're like, yeah, they're going to go take them now. And I was like, you do know that means hospice, right? And I mean, their face just fell because they didn't know. They didn't realize that, oh, my loved one is dying.
Right.
I thought they were just going to like a rehab. I'm like, no, they're transitioning.
Yeah.
And so, you know, I'm one of the reasons why I moved back home. You know, we were in California. I moved back to Charleston, South Carolina. Is I've gone on doctor's appointments with a number of family members, and so many of them have been like, I didn't even know that's why I was taking this medication, or I didn't even know that they had diagnosed me with X, Y, Z. They just told me to take it, so I take it. And no, everyone doesn't have that. Everyone doesn't have a family member, a cousin, niece, whoever who can go with them to the doctor and ask questions and explain things to them.
You really don't. And it's so crazy because I learned this in school, but I don't know how this happened. I think it's because I was shadowing my own, like I had a life coach and I was shadowing him. So when you're shadowing that person, you have to be their personal assistant. If you go on an errand, you have to listen to the whole conversation. Even though you're not doing anything, like you have to listen to the whole conversation. So if your boss is sitting beside you, you have to take notes and know what's going on and blah, 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 blah. Because if you ever have to go there by yourself, you go back and tell your guy, hey, this is what they said. You got to know all the details. Like you have to know all the details of what they said, when they said it, why they said it, why they think it's going to work like this, why blah, blah, blah. You have to answer all those questions. So in doing that, it ended up being kind of a medical skill. Because I remember when you were like pregnant and you were going through like the hyperemesis, or like not even that, like when you were like in the middle of like going to the doctor and we were about to have like I think or something like that, and they had to come and explain to us everything that was going to happen.
Yeah, we were getting induced. Yeah.
And we were getting induced. And they had to explain everything that was happening. And I remember that I had to like really remember, like really lock into the conversation and be like, okay, this, is it that, we're doing this for this reason. This is why they're doing this, and this is what their strategy is. This is what they hope to get out of this, and blah, 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 blah. Because at the end of the day, what you don't realize is that when Sarah is off getting a surgery or something like that, I have relatives that I now have to answer to. Like Sarah's mom is now calling me for this information.
And can you imagine you calling your son-in-law to be like, oh, how's my baby? How's my child and my grandchild? And your son-in-law's like, oh, well, let me do it. Bro, no, I'm coming right on down.
Right. I'm on the next
Exactly.
plane. I'm there.
I'm down the street. Don't
Exactly. So you have to know, even as a layperson in your say you're going to the hospital with your spouse, say you're going to the hospital with your brother and stuff like that, it behooves you to also know how to analyze and have conversations with medical professionals, because now you have family to report back to. And what if something happens? What if something happens to your relative? And now everybody's asking you, well, what was going on?
Yeah.
You know?
Yeah.
And I remember I had a student that I was just like, I'm sorry if I'm monopolizing it, but
No, you're fine.
no. But I had a student that I was like, yo, my man, if your family members go to the hospital, you need to go with them. And you need to stick with them. Like here's the deal. A lot of, especially, and I have to say this for a lot of men, as a guy, what happens here is that what we do is we tend to check out of things that don't seem to involve us. We say, oh, that's talk on that side, that ain't got shit to do. So I'm going to check out of that. But you don't realize that your job to support is all encompassing. That means whatever they hear, you got to hear. Whatever questions that need to be asked and didn't get asked, you got to ask them. So it was like one of those things I was telling the students, like, hey, if your relative is going to the hospital, you don't get to check out until the doctor has left the room. You know what I'm saying? Like, you don't get to check out until the doctor, because a lot of times the doctor will be talking And then you be on your phone like, okay, blah, 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 blah. You ain't hear none of the conversation. You ain't ask no questions. You don't know what they talking about. You can't give nobody a brief back on what's happening. And then as a guy, you just be like, oh, they weren't talking to me. No, you in the room, you need to pay attention. You know what I'm saying? And I think that that's just a level of support as men we don't understand that we need in order to truly support our families and our relatives and stuff like that. We need to always be in the room. You know what I'm saying? And when somebody's out of the room, that's when you clock out. That's when you like, all right, I'm done, because no one's talking.
Well, I would actually even say it's not even when the doctor leaves the room that you clock out, because I'm that dude. I'm that dude. I'm asking the questions. I'm in the face of the doctor. No, you need to make this make sense to me. No, my wife is lying. She's been having pain a lot longer than that.
Thank you for telling her truth.
Oh yeah, because she will lie to her doctors continually. She will tell them just enough
I
to
said I
give
was one of
them
those. I'm the bad patient. I admit it.
just enough to give them so that she can get some kind of diagnosis, but not the full. Well, I've been. How long has your stomach been hurting? A couple of days. No, you've been complaining about your stomach hurt for 2 weeks. I've been fussing at you to go to the hospital for about a week and a half, and we finally now are here. No, doctor, it's so bad that this is going on. But then I'll make the doctor explain stuff to me so I understand it. Yes. And then when the doctor leaves the room, the reason I was saying that I don't think you can even check out once the doctor leaves the room, because once the doctor leaves the room, that now was the opportunity for me as a man to start checking in with my wife and saying, hey, okay, how do you feel about this? What are you thinking? What's going on? What's going through your head? While we're in the moment, because if you wait till you get to the car or wait till you get home, the mindset, at least of my wife, is, okay, I've already processed it. I'm trying to move on and deal with some other stuff. I don't feel like dealing with that right now. So while we're already in the moment, we have no choice. Let's go ahead and do this, because I'll call the doctor back in. She's been at the hospital, and nurses hate me, because what's not going to happen is you not talk to me and you not talk to my wife and you not treat her. Oh, no. We came here to get X done. You're going to do X. Oh, no, no, I didn't ask you what you think you need. I'm telling you what we want. We're paying you. So you need to do the thing. I get what you're saying. This is what's going on, but these are some other things we want to have done. And when she told me about her experience with her doctor and all the information that she gave her, I was floored, because it just didn't make sense to me that, especially because I'm a dude, most men don't really go to the hospital as is anyway. And when we do, especially as black men, most doctors are too afraid of us to not give us the full thing. They want to get us in and out so they never have to see us again. We may get short treatment, but we're going to get thorough.
Right.
Black woman, that's not really the case, y'all. When she told me the stuff that was never done, never thought about, and even while she was talking, I was thinking about how many trips to doctors and hospitals and different things that we have been through in the 12 years we've been married, and nobody thought to do this. Not one person. No. She's had surgery, and not one person was like, "Hey, look at this while we're here." Nothing. It just baffled me. So I was like, this is information that's necessary, because people don't know what they don't know. And the vast majority of the people, much like Philonda, didn't know that these things could be connected. You don't know what you don't know. There's nobody to give you care resources. Then you won't know to ask.
Because for me, I was thinking, okay, gynecologist, she's the under the hood doctor. And so the rest of the car, the rest of the car, I got to go take that to somebody else, to a body shop for them to look at. And then here she is reading me my whole life. And I'm like, and I was like, you ain't even, she hadn't even did an exam.
Wow.
All in a verbal conversation.
And that honors the doctor-patient relationship. When you can get sufficient information just from holding space with your patient, asking them questions, being genuinely interested in how they're doing, you get so much more information.
Yeah. And I holistically, here it is, I got to 100% agree with Chris. The only reason I went in there with a expectation of asking questions is literally because my daughter has me addicted to TikTok, and I had saw people start posting these videos about what they're not going to gatekeep and tests you should ask your doctor for at certain ages. And I was like, what? So I'm there watching the video, pausing the screenshot, and so I'm going to the doctor like, okay, I don't know if it's okay, but can you check my iron? Can you do this test? Can you test my thyroid? And she was like, sure, we'll do all of that. I was playing. I was like, okay, because I heard I'm supposed to ask for these things.
I love that.
So many of us who don't know, we will go and buy a car and ask how many miles does it get to the gallon? What is the tires like? What is the engine like? All of these features, but we will go to the doctor and have no clue what we need to be looking for.
None.
But we've also
None.
been taught and trained that though.
Yeah.
Like for car commercials in cars, we're always taught when you go to the doctor, these things, or excuse me, when you go to look at a car, these is what you need to look at. And when you get the car, see when you do the test drive, you can take it to a mechanic and have them look at it and make sure you know your lemon laws. And car commercials when we were growing up actually used to tell you about the car and not just the car driving around looking pretty. And so we grew up thinking that no one ever tells you what to talk about with the doctor. Our job is, okay, tell them what's wrong, and then when the doctor tells you what to do, you just do it. Mm-hmm. Like they say that health is wealth, but your health can only be wealth when you recognize that knowledge still is power.
Yeah.
Absolutely. And we've been taught to believe that whole philosophy that doctors are experts, which is not like that's false. But what people don't realize is that expertise still requires communication. So
Yes.
you, as a person who is an expert, I don't know what I need to know until you tell me that. So if you think of something that's not really that. This is trivial. This is trivial information.
Yeah.
And you hold that in, you don't realize that I'm making connections based on that trivial thing you just said.
Mm-hmm.
So as people who are going to a doctor, even dealing with an expert, we don't realize that we don't realize the language that we need to even say to describe pain. Like we don't even realize that we need to say burning instead of stinging, or aching instead of blah blah, or itchy instead of, you know what I'm saying?
Yeah.
Or like, you know what I'm saying? And it's just those little phrases that we use that can like send a medical professional or any professional that can make a clear distinction between like, oh, I was thinking it was just this, but you said stinging.
Yeah.
And that put me down this path.
Yeah.
So,
and I really would have to say that the biggest villain in all of our issue with our, medical system is the insurance companies.
Oh,
I don't know one single doctor who doesn't want to spend more than 15 minutes with their patient. But if they bill insurance, they're only going to pay you. If you go over that, they're not going to pay you to see them for 30 minutes. They're only going to pay you for 15. So sure, you can sit there and talk for 30 minutes, but you only get 15 minutes worth of pay. And, that doesn't provide enough of a return on investment for your doctor. Your doctor still has to run their practice. They still have to do all these things. And it's almost like their hands are tied by our medical system and private paying insurance.
okay. So with that said, the doctor that we used to go to that was the pediatrician, they had a different system. It was like a membership based thing.
Right. So she would still bill insurance for like vaccinations, regular child visits. But she had a membership. And so we would pay a flat amount per year, and then that would cover X amount of visits per month. And she actually would spend so much time with us, talking about our kids, talking about, you know, diet and nutrition things. And but she had to have special training outside of medical school to educate her on nutrition and supplements, because your medical doctor does not learn that in medical school. They have to get outside training for that. But she also was able to practice how she wanted to practice, because she was able to make her own rules.
Right. And I would suggest that, like, anybody who's listening to this, understand, like, the structures of the medical facilities that you are going to, because you don't like, sometimes, like, when I heard about it, I didn't even realize that was a thing. Like, there was like there's a membership kind of doctor that you can go to where you can just kind of pay a flat fee, and it works completely different. And like Sarah said, it was the difference between going to just a normal doctor versus going to that pediatrician was night and day.
Oh my gosh. We went to a different pediatrician one time, and I was like, oh, you have to wait. We've been waiting for 30 minutes. This is
like 30, 45 minutes.
Absolutely not. No, I will.
And we got in there, it was in and out, boy.
Yes.
Like, it was like, ugh. Like, and going to that particular place, it was like a breath of fresh air, because they do sit and they talk with you, and you go over, you really get to know your patient. It feels like the doctors in the olden days. It feels like
when they used to do home visits and come. Yeah, exactly.
It feels very much like, oh yeah, you know your doctor knows you. They know, like, they know what's going on with you in your life and stuff like that. It was a completely different experience.
Yeah.
So I don't know, and maybe Sarah might know more about this. Like, I don't know how you can, like, do that kind of research, but, like, the way that their pricing structure for that medical facility is extremely important for knowing the type of service that you're going to get. Because if you go to a regular hospital, it's long waits in and out, and that's what you're going to do. So if you can look for a facility that specifically maybe advertises that they work differently than an average doctor.
It's called direct patient care.
Okay.
So you can look up direct patient care practices near me or something, and you can find practices that generally have that type of model.
And they accept insurance too. So
right, so your usual annual stuff will get covered. Yeah.
So I thought that was extremely cool.
Yeah, that's mind blowing. I'm like, wait, that's a thing. When we were at the end of last year, trying to pick our insurance provider through our job, and I was doing some research. I'm like, okay, is there another way? Because you hear like these forward programs, and I was Googling here, and they were like concierge medicine, and I was like, oh, well, that's for the very wealthy.
I'd say, yo fancy, yes.
Right. I was like, in my mind, that is, you are extremely wealthy, and doctors show up at your house with a little bag and all the equipment, all the things you have to leave the house. But it literally had like, okay, this is our annual fee. This is what's included, unlimited doctor's visits, and then like certain things like procedures and stuff like that. And it had it written out, and I'm like, I want that. How do you get that out of my paycheck pre-taxes?
Right, please
I
and
want what my company is offering. I want that.
Yeah. And sometimes you have to step outside of that and like get supplemental coverage on top of what you get your from your job. So you might have to go outside and pay outside of pocket for the direct primary care, but at least you're still under that insurance umbrella.
Exactly.
So here's a question I have real quick before we go to commercial break and get into our second segment, because as great as this information is, we could be here for 7 hours, and I have learned my listeners won't sit here for 7 hours on my podcast, which means we got to get you back on.
Yes.
Here's my what I would say is my closing question before we hit this commercial break and come right back. What would be, and I'm sure you probably in some ways answered this already, but the specificity of it coming as an answer to a direct question probably will help some. What would be the top 3 things, most important things you would say to any person that is getting ready to go see a doctor about an issue? What are the top 3 things either they need to know or need to do when going to see this doctor?
Number one, prepare. Oftentimes we put an appointment in between a work day, at the end of a work day, and we don't take a time to sit and say, okay, what is really bothering me? Let me sit, get grounded for a minute. Where is my pain? What does it really feel like? When does it happen? How often does it happen? Really just sit down and prepare so that you can write notes. Also, write notes. Write down what you want to tell your doctor. For me and many women, I track my cycle on an app. In that same app, I'll write down something that happened today. I had pain on my left side, or 2 weeks ago I felt nauseous. Like, take these notes so you can take them to your doctor. The more information you can give them, the better, because you're actually helping them. You're not hindering them, you're helping them. So that's number one. Number two, get to know your family history. I think, Philanda, your story is genius, because if you hadn't had those questions, if you hadn't already had these discussions with your family, if you didn't already know that your mother had struggled with XYZ, or your grandparents or whoever, so get to know your family history. Ask why Big Daddy passed. Ask why, grandmama is struggling with XYZ. So get more information about that. That's number two. And then number three, know that you have power as a patient. You do not have to accept poor treatment. When I tell you, you pay too much for your insurance to be seen by a doctor who does not value you and who does not see you, and really is just so overwhelmed with their whole day that they're not seeing you as an individual. You have power as a patient, absolutely. So, yeah. Number one, prepare. Number two, know your family history. And number three, honor and really carry your power as your patient.
Okay.
I love that.
Me too. And actually, it brought up one more. I lied, so I got one more question. I promise we're gonna go to commercial. I promise you. One more. Part of the reason that it was so fascinating to make sure that you were on this episode of this podcast is that you are a practitioner of and a teacher of, and I know I have to be careful with how I say it because of where you're at. Let's call it non-traditional medicine practices. I'll say it that way to make sure that you know.
Don't get it locked down. Thank you.
What is the number one misnomer about that practice that you could clear up for people who would say crazy things like, I don't trust that. I'm gonna go ahead and pop all of these pills that are gonna destroy my body, even though I don't know it's gonna destroy my body because my doctor said it's gonna help me. What is the number one thing that you could try to tell them that would clear that thinking that has been ingrained in us because we just don't know any better?
Man, we could be here all day. Okay, so what's one thing I would say? This medicine. Okay, let me clarify. I'm a naturopathic doctor. I
wasn't sure if I could say that. That's why.
Right. Well, I have that degree. Okay, so yes. However, I live in South Carolina, and so I know I do not practice naturopathic medicine in South Carolina. Okay. But that's my education, that's my title, right? Naturopathic medicine, I tell everyone naturopathic medicine is Black medicine, Black people's medicine. because our ancestors, they didn't have doctors coming to see them. If they really needed something, sure, maybe they'll drag out the town doctor, because at the end of the day, our ancestors were their property and they wanted their investment, right? We had to have people and elders in our community who knew the plants, who knew the herbs, who knew the signs of disease before other doctors did, who knew secret things to do to help you feel better, right? My number one rebuttal to that is, this is our heritage, this is our medicine. And those same drugs that you're taking are rooted in plants. There's a heart medication, digoxin, they don't use it often, but that comes from a plant. A lot of cancer chemotherapy drugs comes from a plant. So if anything, we're going back to the origin. But I always like to say, there is room for both. There is room for both naturopathic, integrative medicine, and allopathic medicine. I tell people, if right now, at this very moment, you're having a heart attack, do not come to my office. Okay? I do not have herbs for that. You go to the ER, you get stable, and then you come back and we'll work on your diet and lifestyle and supplements so you don't have another heart attack. So make room for both. There is more than enough room for both care, and we need both care, both types of care.
I love that. I love that. So y'all hear that? Y'all stop fighting and acting like these things aren't what you need. It baffles me, and it started baffling me way more with COVID happening.
Yes.
That these people are like, oh my God, I don't know what is in this vaccine. Although I'm not vaccinated, that's a whole other issue. I don't know what these natural things are doing, or what I'm scared of it. I'm like, yeah. But I've seen places that you go to restaurants and eat. You don't know what's in that food, nor do you know the hygiene of the person who has cooked.
Come on, say that one more time.
You don't know the condition of the pots and the pans and stuff is cooked in. You don't know none of this. You put all kind. You really don't know or in Pepsi or in Mountain Dew or Cola. You don't know what's in this stuff, but yet you digest it.
You willing to drink tap water?
Say again.
I was saying, I'm just talking trash. I'm like, you drink tap water, friend. Like, if you trust your city water, come on.
If you're in our age bracket, you used to drink water from a hose in the backyard that stayed out there 365, and yet you are scared of natural. You was drinking rust.
You really were. And bacteria. That's a miracle we made it, y'all. It really is.
It is.
Rust with ant poop and spider poop and fly poop all in the hose, and you would just let all those eggs and feces and stuff get in your throat, and you scared of what could actually help you that has been proven. Yes. Stuff that it is, because though we seem to live longer, it feels like it to a degree.
Yeah.
We live worse now than ever before. Yep. With all of the advances in modern medicine, we live worse.
Weathering.
People in the 30s, the 20s, the 1800s, yeah, they were dying from the crazy stuff, but a lot of the stuff that's killing us, they were able to live through because they used natural stuff. Yep. So why are you scared?
It's amazing because growing up, we and I know we got to go to commercial break. I'll make this quick. But growing up, it was always, we don't need to eat like Granny and them used to eat. You know, we need to be eating better, blah, blah, blah. And yes, that is true because, you know, sometimes we do cook all the minerals up out of our food, you know. Mm-hmm. We do eat a little too much meat, a little too much fat, and all of that, correct.
No such thing as too much meat. But
the way that we eat now is way worse than what our ancestors did. Our ancestors ate fresh fruits and veggies that they grew themselves. If they ate meat, it was either from animals they had on their farm or a neighbor down the street had on their farm. They had actual whole foods that came out of the ground. They knew exactly where their food went. We eat processed stuff with dehydrogenated oils, red number 6, yellow number 9.
And number 6 tastes delicious.
High fructose corn syrup, things that do not exist in nature in the way in which they're placed in this packaging, right? Mm-hmm. So it's almost time to reconsider that. We do need to be eating like our ancestors. We do need to be out here gardening and knowing where our that's my
I holistically believe that, except I will accept no slander on red number 9. That tastes delicious.
I mean, I was out there because you know.
So on that note, we're going to take a real quick commercial break. We'll be right back and with some more Real Talk with Dr. Sarah Ellis and Chris Ellis, the business life coach, or excuse me, the small business coach. I'm so used to saying life before coach. I apologize, sir. The small business starter coach who's going to help us understand some things about starting a small business and what it takes to do so. Both of them have a podcast that we will be mentioning a little later, and I want you to flood them with likes and flood them with subscriptions, get all of that so that what they do can be promoted. We'll be right back after this message from you.
This is Real Talk Radio. This is Real Talk. High Praise Ministries presents Real Talk. This is Real Talk Radio. This is Real Talk. High Praise Ministries presents Real Talk.